A new study from Ohio State University raises serious concerns about the long-term effects of high-fat diets, particularly for older adults. While the risks of obesity and metabolic disorders from consuming too much fat are well known, this research suggests that even short-term exposure to high-fat foods could have immediate and harmful consequences on the aging brain. Memory impairment and brain inflammation were observed in older rats after just 3 days on a high-fat diet, highlighting the potential dangers of unhealthy eating habits beyond just weight gain. The study involved separating young and old rats into groups and feeding them a high-fat diet for either 3 days or 3 months. Predictably, the longer-term exposure led to significant metabolic dysfunction in both young and old rats, including poor insulin regulation and shifts in gut bacteria. However, what was unexpected and alarming was that even after just 3 days on a high-fat diet, the older rats already showed cognitive decline and increased brain inflammation. The younger rats, on the other hand, did not experience the same immediate effects, suggesting that age plays a critical role in how the brain responds to dietary changes. This research is particularly concerning because it suggests that obesity is not the only link between diet and cognitive health. Much of the previous research in this area has focused on the effects of obesity on brain function, but these findings indicate that simply eating a high-fat diet, even for a short time, can be enough to trigger inflammation in the brain, leading to memory problems. The study's lead researcher, Ruth Barrientos, emphasized that this inflammation appears to be the primary cause of the memory impairment, not just weight gain or metabolic changes. This means that even individuals who may not be classified as obese could still be putting their brain health at risk if they regularly consume high-fat foods. One of the most troubling aspects of the study is that the level of fat in the diet, 60% of total calories, is comparable to what many people consume in fast food meals. Popular items such as a McDonald's Smoky BLT Quarter Pounder with cheese or a Burger King Double Whopper with cheese fall into this category, making it clear that everyday dietary choices could be setting people up for long-term cognitive decline. With fast food and processed meals being a common part of modern diets, many individuals may be unknowingly increasing their risk of memory impairment and brain inflammation, especially as they age. The findings also suggest that younger individuals may have some level of protection due to their body's ability to counteract inflammation. However, this resilience does not last forever. As the body ages, its ability to fight inflammation weakens, making older adults far more susceptible to the harmful effects of a high-fat diet. This means that even if unhealthy eating habits do not cause immediate cognitive problems in younger individuals, they could be laying the groundwork for significant memory decline later in life. One major concern is that these findings highlight a gap in public awareness about how diet affects brain health. While people often associate unhealthy eating with obesity, diabetes, or heart disease, they may not realize that what they eat today could directly impact their cognitive function in the future. The study underscores the need for greater attention to the effects of diet on brain health and the importance of making healthier food choices earlier in life to reduce risks later on. There is no simple way to determine exactly which components of the high-fat diet were responsible for the memory impairments, as both young and old rats in the study showed increased glucose, insulin, and inflammation levels. However, what is clear is that brain inflammation was the critical factor in causing memory problems. This finding reinforces the need for more research into how different diets affect brain function, particularly in aging populations. Ultimately, this study serves as a serious warning about the dangers of high-fat diets. While metabolic issues like insulin resistance and obesity are well-documented risks of unhealthy eating, the potential impact on memory and brain health is just as concerning, if not more so. Older adults appear to be particularly vulnerable, with even short-term exposure to a high-fat diet leading to cognitive decline. Given that many common fast food meals contain dangerously high levels of fat, this research should serve as a wake-up call to reconsider dietary habits before irreversible damage occurs.